Today's episode brings us to focus on a conversation that asks how to improve rural health funding mechanisms and investment diversification so that access goes beyond basic care to include specialized and sophisticated services that rural communities also need. In the United States, nearly 60 million people live in rural and semi-rural communities. Yet, fewer than 10% of physicians practice there. At the same time, more than half of the rural hospitals are operating at a loss, and access to specialized care is becoming harder every year. When we talk about rural health funding, the conversation often focuses on government budgets, donor funding, or health insurance. But the reality is that public funding alone is no longer enough to meet the needs of rural communities. As budgets get tightened, many healthcare providers are quietly being pushed out of practice, not because they no longer want to provide care or because patients do not want care anymore, but because the business of delivering this care is becoming unsustainable. So the question becomes, if public funding alone cannot carry the weight of healthcare, what other model can we introduce or can we look at as a way to keep local people accessible to healthcare in ways that are sustainable? And what does that mean for rural communities who simply cannot afford to lose another provider? My guests and I are going to explore, all of this model, or at least one of this model that is called private practice. Not as a profit-first medicine, but as a viable financing and care delivery model. When done right, this can expand access to timely and specialized care, support providers who provide services in places where big hospitals are unable to.